International Day of Forests. And to celebrate, we're going to be talking about tree planting with for healthcare. So as you know, we do a little rundown of our teams before we get started. So at the moment, we've got our MBT sustainability team and our UHBW sustainability team that are coming together to work as one super power sustainability team under the ICS and to implement the ICS Green Plan that will be coming out very soon. So sustainability has lots of many definitions, but we come across to it from quite a holistic perspective. So we talk about sustainability in terms of the financial sustainability, the mental well-being sustainability side, and of course the environmental sustainability side as well. This infographic here is quite useful. It kind of shows how sustainability and healthcare are really intertwined. So it starts off in the middle with, as you can see, the adverse weather conditions and environmental changes that we see from climate change. And then it comes out into all these things that we need to survive. And then it comes out into how these things affect how we are and our mental health and our physical health and well-being as well. So in terms of the sustainability definition, correct me if I'm wrong, Alex, because I always get this one muddled up. It is enough forever for everyone. If that's right.
Yes,
Which
that's right.
essentially, yeah, that's right. Bit of a tongue twister, but it essentially means that we have enough of all of these things for everyone to survive forever. But because of climate change, these things are being risked at the moment, and yeah, up to some damage. So moving on to tree planting for healthcare and celebrating the International Day of Forests. So the theme for International Day of Forest this year is actually forests and health. So it fits perfectly into what sustainable healthcare is all about. So NHS Forests talk about planting trees on healthcare sites to create better places to live and work. Trees provide privacy and seclusion for staff and patients. Cool buildings provide cleaner air, create habitats for native wildlife, and obviously store carbon as well. So MBT were lucky enough to be involved with the pilot study or the pilot project of the Nature Recovery Rangers, which was our Nature Recovery Ranger Phoebe that has now sadly left us. But she did loads of work at MBT on planting trees across the sites to improve the quality of green spaces and help integrate nature into patient care, staff wellbeing, and community engagement. So just to quickly look at what's happening at MBT and some of the stuff we've done recently, because there has been a lot going on. But in 2021, the Trust donated NHS forest trees to the local community and took part in planting 200 Ecosia sponsored trees at the Trim Valley, a green space near Southmead Hospital. We've also planted 500 trees at Frenchay Hospital, which has created an NHS forest, and it's hoped that these trees will help mitigate the effects of ash dieback, improve succession, increase biodiversity through the woodland, and will also be used for forest schools and local children to interact with the woodland as well. I was also trying to get a number for the total number of trees planted in the last 2 years while Phoebe's been here, but I was not able to get that. But it is a lot. If you look at those numbers, 500, 200. I know recently, I think it was 30 fruit trees that we planted at Cosham. We've also planted some fruit trees at Lime Tree Park. So yeah, this number is just growing and growing. So it's a really exciting time. In terms of what's happening at UHBW as well, they had a preliminary ecological appraisal completed for both Bristol and Western sites, and then a subsequent biodiversity action plan for both sites. They since had a tree survey completed last year, which has helped identify the type and condition of all the trees and formulate a management plan. There's also some nice photos there of all their different green spaces as well. So it's really coming together. I'm going to hand you over now to Billy, who is another Nature Recovery Ranger, and he's at Mount Vernon Cancer Centre in London. So Billy, do you want to get going and tell us about tree planting?
Hi everyone, nice to meet you all. Yeah, so I'm literally the equivalent of Phoebe, but at Mount Vernon. So I've only been here about three and a half months. So it's all a little bit new to me as well on the site. So I'm just gonna let you know a bit of the site specific sort of situation going on here. I'm mainly going to talk about forest gardens. I'm not sure if anyone knows too much about them, but yeah, it's for me, it's what I studied in my permaculture course, and I don't know if anyone knows too much about permaculture either. But any questions, I'll be really, more than happy to answer, because I know sometimes people hear about permaculture. No? Is it just my voice echoing, or is it someone saying something? Oh, sorry. Yeah. But yeah, so I remember when I first heard about permaculture. Oh, sorry. I don't know if someone's speaking or not. I keep
Sorry,
hearing
yeah, I think
someone
it was
speak.
Kerry, but I've just muted.
So I didn't know if it was my own voice echoing or if it was just someone trying to ask a question or not. Yeah, so two things I'm briefly going to touch on is permaculture and forest gardening. So permaculture is really about green care, earth care, fair share, and it's a design principle, and you can use it in anything. You can use it as design for your life. You can design your balcony. You can design your office. It's just to make your space really efficient, and just have a deeper understanding about the connectivities to outside sort of environments. So, for example, people are, we're asking what is sustainability. It just means so many different things to different people, and permaculture tries to get to the root of like just a real deeper understanding of who is actually benefiting. So, coming on from there to look to the forest gardens of what I'm how I'm designing the site where I'm at the moment, it was interesting to sort of have a co-design. So this was really important as a sort of first port of call. Is not just to like just plant trees. It's to who are they going to benefit and why you're going to be planting the trees. So we looked at a fair few amount of stakeholders. We looked at the patients, the staff, schools, institutions, estates, the council, soil type specialists, garden centres, farms, allotment holders, permaculture groups. So anyone that is slightly connected to your site, you by sharing all your resources, I think it's a really good way forward. And the more people you can include, the more times you're going to create things like empowerment and ownership to try and then the system will run on its own. It won't need someone to be in charge of it. It will just be very resilient because of the amount of people in the background. And it's, especially if you're sort of having lots of young people involved, it really creates a good sort of community. So that's what we're trying to. It's not just planting trees; it's sort of growing communities as well. And just to make sure that, again, why are we planting trees, and how can we do it in a way that's not excluding any sort of marginalized groups as well. So that's sort of really important, is the social sustainability aspect of it as well. So yeah, so that's kind of like the backdrop between the design and making sure that you involve as many people as possible. But then going on to the actual physical design of what trees you're going to plant and where. That's also, if you have to think, if you're just planting a forest, for example, I think Georgia was saying about planting trees to uh, the benefit the ash trees that are going to be dying back. It's to replace those ones. So it's really good to think of the reason of why you're doing it, and who is going to benefit. So at the site we've already got like a forest, a small strip of forest land. So for me, it was trying to look at this design of a forest garden to try and add on smaller trees after the canopy layer. So then you have a canopy layer, you have a low tree layer, which could be a lot of an apple tree that's grafted onto a quince root, so it keeps the tree small. Then you have a shrub layer, and then a herb layer, and a ground cover, and then your rhizomes in the root layer, and then the climbers in the vine layer. So you have these 7 different layers of a forest garden, and it also creates these walkways that you can walk through as well. And then it's sort of really sort of, people can go, and it's very explorative, and it's you're curious to see what's around this corner, what's around this corner, because you have such an abundance, and you have such a vast biodiversity sort of all plants and all animals, because you have so many different kind of ecosystems involved, and it's all sharing the light. It's like many people have heard about vertical growing as well. It really utilizes the light in so many different ways. So the main principles we've got think diversity, we've got observe and interact, use minimal effort. So that's also part of is low maintenance as well. We have like use your resources responsibly and efficiently. So again, including all the people, your neighbors, any institutions that are around you, try and get them on board, because you can share ideas, and decide your group structure together, look beyond the edge, and then learn to celebrate. And I guess, yeah, learning to celebrate is a really good one, because we're all learning together. And it's also, even like my background before becoming a nature ranger was, utilize the experiments as well. So make sure that you've got a chance to learn from doing, and learning from your mistakes. So then we have the primary aims for the system, which are to be biologically sustainable and able to cope with disturbances such as climate change. So talking about being, in sustainability, the forest garden is, against drought and against flood, it's very, well protected because of the diversity. To be productive, so yielding a number of large or different products. So on each layer of the forest garden, we have, you have nuts, you have fruit. I think we have a list here somewhere. Yeah, nuts and fruits and edible leaves, spices, medicinal plant products, poles, fibers, honey and fuel wood and fodder and mulches. What we're also doing is creating a system where we're sort of teaching people about trees, but we're also limiting our we're consuming less and producing more. And I think that is if you're going to try, rather than sort of offset your carbon by planting trees or being associated with an institution or a company that is offsetting carbon, we should be really trying to, educate people how to produce more and consume less, rather than, the very much more corporate, just offset your carbon, which there's a lot of research which, suggests that that's not really the right direction to go in. Yeah, I think that's the end of my slides. So it'll be really interesting to see if anyone's got any questions about the things that I've been speaking about, or anything else. But it was really nice to be a part of this, and thank you very much.
Thanks, Billy. It's so interesting. Yeah, has anyone got any questions for Billy?
What was like so Phoebe would she be on this talk before me? Would she have been doing it? Okay.
Phoebe would have been, yeah, I'm sure Phoebe would have had a long list of things, and also obviously has the knowledge as well. But it's really interesting to hear from your perspective what's happening at other sites, especially because I know that your site's in London, but it's on the edge of London, isn't it? So you do have that green space, which I know Alex has her hand up at the moment, but the site that she's at UHBW is a lot less green. So it's interesting to hear from the different perspectives of what we can do with these sites.
I'll just come back on that one and remind you again that we have Weston.
every time.
Yeah, so we've got quite a few trees there. I was going to say, in terms of things like Dutch elm disease, if we're taking those trees out, is there any particular kind of way that is the best way to go about replacing them? Like, what are the types of trees we should be putting in? What kind of good native trees that again are going to be good in terms of our changing climate going forward?
So, I mean, ideally, what you would do is you would see what kind of soil there is, what kind of climate it is. It's very site specific. For example, we have poplar trees on site here that are right next to buildings, and they're basically native to North America, where it's rocky. So their roots are going the roots are not going straight down; they're going acrosswards. So they're falling over because they're not native to that area, but only because it's clay soil where I am. But it really depends on what soil you would have, on your site, and then it's about. Well, I was coming back to it before. It's about the design. You're thinking of it a design aspect, and who's going to be looking after these trees. It's okay, just say, oh, let's plant these trees and where we plant them, but where's the aftercare? Where's the sort of the community behind them that is going to look after them and nurture them and learn from them? That's, and it also, I think someone said a question about the spacing as well of trees and the layers, and how do you ensure it? And that is all part of it. It's about if you have a space, it's about, normally you would take quite a long time. You would take about a year to actually look at the space, learn exactly how nature is working in that space, like for the sun and the wind and the animals, and who is using it, what is native. And then you would come up with a plan about positioning what types of trees where, but also that would be a case of what trees are you going to use, is how are they going to be put into the community, and how are they going to work, and who's going to use them. So it's not, it's at least a lot more complicated than just, you know, replacing trees, and it's very specific to what site you're at.
Great, thank you.
But,
To think about.
for example, the site I'm working, we already have, you know, a forest. So what I'm doing is either side of the forest, I'll plant, you know, a certain amount of different trees, just so that it sort of thins them out a bit, so that it follows succession. So succession is where you have, like, you know, you have like nothing at all, and then the first plants would come in, like your weeds, and they would start to build, and then layers, and then you have shrubs. So you would have this succession of a canopy tree, smaller tree, shrub, and then, you know, like grassland or a ground cover. So we're sort of trying to mimic nature in a way, but utilize it to sort of help us, you know, help us recover. But then we're also learning from nature's design to build something that is very resilient in a way, because there's increases so much biodiversity. We are, you know, and also you have to think about the soil as well. So the soil that we're building rather than replenishing is going to make it, you know, if you're mulching a lot and you're mulching all around your trees, if there is a drought, it's going to be very resilient to that drought. And if there is a lot of rain, it will be able to absorb, all the organic matter will be able to absorb all of that water, so that either one of them, it's going to be really resilient. But it was interesting, because I came to the site in Southmead, and it was exactly that. It's the site specificness of it, because you know, where I am, we have quite a large forest at the back, but obviously in Southmead it's all big buildings, and it's sort of little court areas and spaces that you're planting trees on. But it'll be interesting. It's like, you know, certain schemes of like adopt a tree or something, or certain people can look after a tree or take ownership of it. Again, it's just you're increasing people's understanding of the trees and of the plants and how they're connected to into our lives, and then that goes straight into like social sustainability and healthcare, because they go arm in arm.
Yeah, I think that's really interesting, especially because we come forward with all these numbers of how many trees we've planted, which is amazing, but actually to have that personal connection with the local community and staff to those individual trees is, yeah, that's really cool.
Yeah,
anyone?
Part CHS, yeah, so Centre for Sustainable Healthcare, they've with is it, I think Vicky from comms is just working on this template that is actually asking us why we're planting trees, and I think that's a really good you know, point to, rather than just plant loads of trees, it's asking ourselves why, and then finding out the understanding of why and how there are so many different reasons to plant trees, and that just makes, you know, I mean, it's just a really great way to look at it, rather than just offsetting carbon.
Definitely. I was wondering, because you were talking about who's responsible for the care of the trees, and like in your site and your community, do you have people from the local community that are helping with the care and maintenance?
I mean, yeah, so volunteer groups, we've got volunteer groups, but it'll also be working with the states, you know, rather than, you know, the states just coming to, you know, trim all the trees, all the bushes all the time, and cut the grass just to maintain it, rather than take a bit more of an interest into, you know, again, why you're planting this tree, and what can it be good for, rather than just as a nuisance to cut it back every, you know, 2 years we need to cut it, rather than thinking, okay, this could be a willow, this could be something that we could coppice, this could be something that we could use, you could make things out of it, we can sell it, certain things like that. I know it's a bit difficult, because, you know, you'd need someone else then to come and do that, but I think that's behind that, is again, is sharing the resources you've got, and connecting. So yeah, you know, just making contact with local, you know, there's people that I would like to get in touch with regarding like mushroom growing and beekeeping, and you know, if you've got people like that that can come on your land and utilize that, then you know, that's the way forward for me, because you're just, you know, you're you know, just making them a lot more products, and you're producing more, rather than just you know, spending money on maintaining.
Anyone else? Any questions?
Me again. Hi. Just going back to the carbon offsetting thing. Yeah, like I fully agree with what you're saying about you need to try and obviously reduce your emissions before you offset, which I think, you know, is what we're trying to do. But inevitably, I think you always will have something you need to offset if you're aiming for net zero. And I'm quite interested in trying to work out if we can use any of our green spaces on site as our offsetting. And when we're planting trees, kind of measuring that and using that as our offset instead of, paying some company somewhere else to kind of do it. I just wondered if you had any experience of doing that, because I wouldn't know kind of how to start, or if there's like calculators out there that can kind of do it for you, that kind of thing.
I mean, I don't have much experience in carbon offsetting at all, really. I would say that it's definitely something that you can use as part of it. But I think what the point is I'm trying to say is when people are doing it as just solely for carbon offsetting, you're losing any sort of connectivity to nature, because it's almost becoming like a tick box thing that you can fly somewhere because I've offset my carbon, but you haven't. There's nothing really been offset. It's just the system that's been involved to make sure that people are thinking, okay, we can do this, rather than actually we can consume less. For me, it's going down slightly down a sort of red herring sort of. Sustainability is a way of that, of corporations being enabling them, rather than building communities that are more resilient. But there's definitely room for both. I'm not saying that there's definitely room for both, but I just think they could be mixed together in a bit of a better way.
Yeah, it's almost the flip of that for us. I think, we want to do it for the exact reasons that you're talking about, but that argument necessarily doesn't always get us very far in a healthcare setting, because I think there's still that real kind of disconnect between, health benefits and nature, or in terms of the NHS and what it's able to deliver. That's not quite there yet. And so actually, if we can talk about, actually, if we do this as well as all of those benefits, it'll help us in our offsetting, and so there's a financial saving associated with that. That can almost just be another argument to add in.
Yeah, I think this is great, because you're incentivizing it, which is also another strategy in moving forward. If you can incentivize it, it was actually really interesting. I think a paper we were discussing a few weeks ago about how this organization were actually trying to sort of see how much a forest was worth in money terms, and so that you could then use say this forest is worth this much to social and healthcare because of this reasons. But then we came round to thinking, well, if you can put a price on it, it will only mean that someone else can then put a higher price for something else, and then you've put a price on it, and then it can be really negative. But it was really interesting to see that dialogue, to see about how people would see it. It's almost like we've come up with an idea of a way of showing how important forests are. We've put a monetary value on it, but then it could actually turn on its head, because it can really be detrimental to society, because then a business could come in and say, but we could make this much money with it, and they could create a different sort of system. So yeah, that was really interesting, I thought, that paper.
Yeah, definitely. If you find it, let us send it over.
Definitely.
I will do. I mean, it would have been obviously with Phoebe, but I will definitely send it over. It was I can't remember her name. Yeah, one of the ladies that just works for NHS Forests, and it was a paper that we discussed on one of our green healthcare seminars.
Was there someone else with their hand up?
I think Rosalind did.
Rosalind, yeah.
Oh, hi. Yes, thank you. Hi, Billy. Thanks. That's really interesting. I'm a psychologist in UHBW, so I'm particularly interested in what you're talking about there around kind of like the mental health and well-being and the benefits of that with nature connection as well. And I was just wondering about, I know that green social prescribing is becoming a much bigger thing, particularly in primary care, and whether that's something that links in with some of those groups that you talked about in terms of people who can care for the trees and look after them in that way. And if you have any of those links with green social prescribing networks where you are, because I guess that also links in then, doesn't it, with other healthcare benefits within the NHS for patients as well?
Yeah, I mean, I've actually got a meeting in a few weeks with Natural England and the local council, Hillingdon Council in London, and that's the sort of we were looking at making a certain framework almost that when you go to to nature or to a green space, you can, you know, I think we're looking at sort of a sensory sort of walk, which you could then use your senses as a gauge, as a way of connecting, and also a way of bringing the awareness to now. And then it would be really interesting to see that. I mean, it's very experimental at the moment, all this green social prescribing. It's almost like you just to say, you know, you should just go to nature. But I think the difficult thing is putting it, is it contact with nature or is it connecting with nature? And I think they're two different things, and it really depends also on the practitioner who's actually delivering it. It could be, you know, you could have a completely different experience with one practitioner or with another practitioner. And again, the site is so specific to what that person would that person get out of it. And then what condition has that person got, and how is that, you know, that person's condition, maybe that would be suited to a different type of environment or ecosystem. So one of the things that we're doing on our site is we're creating 5 different ecosystems. So there will be a wildflower meadow, there'll be a forest garden, there'll be a polytunnel, there'll be a lake. And what we're trying to do there is create these different spots that are in really close proximity to each other, so that when people go there and have their, you know, their sort of checklist of how they're feeling, or what they're noticing, or what they see, or what they can feel, or what they can touch, by having 4 or 5 very different ecosystems that are very close, you can go between them and you can notice the difference between them, but you don't need to necessarily notice the difference or why they're different. You just acknowledge that they're different, and it would take not very long time. And I think that as a way of experimenting with, you know, with how nature can be prescribed is, you know, that I think going forward with Nature England and the council, Hillingdon Council, I think would be a really good direction. I think that would be good for any site, would be to try and find out how the nature can be, you know, prescribed for us as well. And not only that, it's also, you know, preventative measures. I think for people that, you know, for staff that are working on site, it could be really good in preventing any sort of, you know, stress or disease that could manifest.
That sounds really interesting. Thank you.
We also have because it's a cancer centre that Mount Vernon is on, and we have where I'm situated at the complementary therapy centre. So we have, you know, art therapy, Reiki, relaxation, aromatherapy. We have so many different types, and so one of the things that I'm trying to do is to see. We've got a couple of pilot projects, is to see how they could be used outside. And at the moment, it's really interesting because it's almost like a barrier, because everything is so set in that complementary therapy, the routine, to then try and say, oh, could we try and do this outside? It seems like it's created more work rather than say, you know, we haven't got enough office space. There's not enough space. This is a problem. We haven't got enough space. But I'm trying to say, well, why don't we try and, you know, utilize the outdoor space? Then we're making more space, but then we can also use, you know, if it's done, you know, if your program is delivered with nature as a sort of to benefit your practice, it's just that little bit experimental and just thinking a little bit different. But I think that's all that, you know, the rangers around every hospital, that it's about that. It's about systems change, and looking at outside in a different way than what we've previously looked at it.